Hi, everyone. We're going to give everybody just another minute to hop on for the QRTP track applicant webinar, our workshop. We're really excited that everybody is here today, but we'll just give a few more minutes for everybody to hop on, and then we'll go ahead and get started.
All right, welcome everybody. You're in the child youth step down options QRTP track. We're gonna get started here in a minute. We're just giving a few minutes for everybody to jump in and get started, but we're so glad you're here. So I think Lindsay is gonna take over in a little bit and start running the slides, and we'll get started here and give us one more minute. Welcome everybody. People are still jumping on, so we're just about 30 more seconds here when people keep jumping on, and then we'll get running on this. Thanks for coming.
All right, everyone, I think we're going to go ahead and get started this morning. And just wanted to, first of all, thank all of you for attending this session today. We're very, very excited for the release of the Child Youth Step Down QRTP track RFA. And so with that, I am going to turn it over to Susanna Snyder, and she will walk us through some slides, and then we're going to leave plenty of time here at the end for any questions that you may have related to the RFA or this application. You can feel free to pop any questions into the chat, and we'll be keeping track of those as we go. And then, like I said, we will open it up at the end for any additional questions. So I'm so happy that you're here, and we will turn it over to Susanna.
Good morning, everyone. Yes, reiterating, thank you so much for coming. If you could also just go ahead and toss your name, organization, and title into the chat, that would be helpful. And if you do want to speak up and ask a question, it would also be great if you could just kind of say your name and go from there. I am Susanna Snyder, she, her, hers. I'm the Child and Family Health Division Director. And I have some folks on my team who are supposed to be working on this. We do have a vacancy for the position that will be filled with a new employee who will be starting in the next few weeks. But for now, we have the Rockstar team of Lindsay supporting from the American Rescue Plan Act project management side, Chris Anderson as our child and youth behavioral health stakeholder specialist, Christina Winship, who works on our benefit management team, who I know many of you are already familiar with, who does much of the very good work required to get kiddos into services. And Mara, who just introduced herself in the chat as well. Those are kind of the folks you are going to see on the HCPF side. And let's get into our agenda. Next slide, please. What I want to do first is provide an overview of the project. Then we'll talk about eligibility of applicants, timeline, submission details, and questions and discussion. We may not have answers to all of your questions. Sometimes the things that we create in our fishbowl are not always easily translatable. I think we have asked for feedback along the way, and hopefully we can address most of them. But things we can't address today, we will take offline and then follow up with an FAQ that we've already started that we can add additional content to. So first, project overview. Our idea with the funds for this project were to support research and analysis with our qualified residential treatment providers, focusing on barriers to service access and provider expansion, gaps in resources and funding, and challenges in discharge and step-down transitions. This cannot and will not directly fund treatment. I'll get to why that is in a moment, but the funds are supposed to be leveraged to support provider participation in research and data sharing. What we know is that current funding levels are not adequately supporting children and youth receiving the services. What we don't have a good handle on is exactly what it's going to take to correct that. So what we're asking for is for providers to use these funds to help us co-create a better reimbursement strategy that more effectively supports children and youth who need these services across the state. The total amount of the project is $2.4 million, but the awards will vary between $170,000 to $340,000. Finally, this aligns with Senate Bill 19222 and several other projects at the department in which we're trying to better support both step-down funding as well as transition funding and better supporting this population. Okay, next slide. So the uses of the funds, like I said, this is going to focus on researching best practices and highlight existing gaps. So awardees will be paid for this research, which includes research informing policy for QRTP sites to serve more children and youth, analysis on current system gaps, barriers to discharge, challenges in service and provider expansion, funding needs, potential changes in workflow that could be needed, provider recruitment and retainment strategy, or development of new models. We know that you on the ground are the ones who see most what the challenges are, and therefore need to be really critical and help us co-create solutions. Other reporting on QRTP services that are necessary for more children to receive effective care in Colorado. We know that there could be more wraparound services or other things that might support these children and families. So as I mentioned, this funding cannot be actually used for treatment. Like this cannot replace per diems or any other billable codes. And this has a pretty strict federal requirement. The language around this is supplement versus supplant. So supplanting funds is not, federal funds is not allowable. This is defined as when an entity uses federal grants for a planned expenditure that would replace funds in an existing budget. Examples of this could be salary for an existing employee. Even if that employee has new responsibilities related to the grant, that's where we've received some pushback before from federal partners. Paying for part of a supervisor salary who is not overseeing a new staff position tied to the grant. Or like I said, a really obvious one would be just being like, oh, well, we're gonna use this to add on to existing per diem rates. Supplementing is allowed. And what this means is new activities. So things that complement existing activities, continuation of programs when funding is ending, or in combination with other funds for a planned expenditure. Next slide, please. Allowable costs include contractor costs to support research collection or reporting, personnel and fringe for research and analysis, project-related travel for personnel, time studies, community availability of skilled staff, process review, etc., and training for providers and staff. Then also finally, project coordination costs. We know that grants take a fair amount of work to just administer. Indirect expenses are permitted, but only up to 10%. Who are our applicants? Medicaid enrolled QRTP providers. I see some of you already on the phone. Currently, you must be providing services to at least one child or youth with specialized behavioral health needs. That child could be multi-system involved. That child could have barriers to discharge in the community in Colorado, or barriers locating and accepting treatment facilities in Colorado. Our timeline. So our application is being posted on the website today. We were hoping we could get it up yesterday, but it should be up before end of day. Our webinar, obviously being recorded today, this will be posted online. And if there is a huge request before the submission deadline, we could consider doing something else once folks dig into the application, if there are a lot more questions that come into our inbox, which I'll get to in a moment. We will be announcing the awards at the end of August, and then working in that next month of September to get the contracting and pre-grant prep. Funds will go out in October and be available through the end of September 2024, with final invoicing to happen at the end of that month. Submission details. Okay, so in the RFA, once it's posted, you're going to see that we have tried, and I hope succeeded, to make the application pretty low burden on providers. As we said, we know that you're having trouble meeting the existing demand, making a financially viable business model. So we are trying not to create too burdensome of an application process. So the first section of our application is going to have organization questions. This is primarily based on just completion of these questions here. There'll be a cover letter. It's 1 to 2 pages. Some details on that are in the application and just signed by an authorized signatory. There are some organization questions just about your qualifications, where you live, what communities you serve, and this will be 5 points of the overall grant. The next section is population questions. Who are you serving? Where are they from? What are the demographics, size, geography? What is your rationale for declining services, selecting all that apply? Just trying to, again, kind of get to that data collection piece. This is not meant to be used punitively, but to help us understand what the needs are in the community. And description of any specialty population served. We know that some of you target your criteria to specifically hard to support populations or have a certain niche in a rural area. This section of the application is eligible for 5 points. Finally, there is just required documentation. There are some attestations to be signed about how the funds can and cannot be used. If you are a nonprofit, we need proof of that nonprofit status. We need certificates of good standing that come from the state of Colorado, a certificate of insurance, including privacy insurance policy or statement that this will be added, an updated W-9, and this is 5 points. Again, this is meant to be really low barrier to access. Okay. I hope I didn't speak too quickly. I see we had another couple people join. I'm scrolling through the attendee list. Let us know your questions and we will do our best to answer. I can't make promises.
Hi guys.
Hello.
This is Carrie with Ariel.
Hi, Carrie.
And-
Thank you for joining.
Thank you. And so for right now, the RFP is just open for QRTPs.
Correct. We are having a short presentation this afternoon. So that will be also posted as well today.
Okay, what time is that?
It's
The
this-
1 o'clock one or whatever, 1, 2, okay,
yeah, 2 p.m.
2 p.m. I think I have that down. That's perfect. My other meeting just got canceled, so I'm gonna let you guys go and then I will return for the church meeting. I think that's the one I need to be at.
Wonderful, Carrie, and Michelle Craig and Brianna Holmes will be at that one as well.
Fantastic. Thanks so much.
Thank you, Carrie.
Bye-bye. You bet.
Hello.
Hey, guys.
Other questions, comments? Okay, I counted to 20, as painful as it was, to try and make sure there weren't any. What we can do, Chris, I think we're able to do this. Oh, thank you. Our contact info. So this is where the RFA will be posted. We can drop that into the chat as well. And we can also, sorry, I'm trying to multitask here for you, share the inbox for these projects for you. And you can reach out there. I think I got it. Yep. Like I said, this recording will be available online if you want to share it with your friends. And if you, again, feel like you get into the application and we are getting a lot of questions, we can do this again when people have had time to sit and think through more of what is troubling them about applying or creating a successful application. Well, thank you all so much for attending. I appreciate your time today. We look forward to reviewing your applications and seeing your questions come in. Thank you so much.
Can't.